Hey there, Toby Stark, Stark Associates Insurance Agency. I just wanted to take a moment in this video to help you with Medicare eligibility FAQs or frequently asked questions. People call the office and are very confused. When do you start to enroll into Medicare? Do you have to enroll in Medicare? If you're already enrolled in Social Security, do you have to do anything? You're still working past age 65. Are you supposed to do something then? What if your spouse has never worked? Can she be eligible? She didn't pay into the system. So these are some of the questions. We're going to unpack this for you. And the first question is, do I automatically get Medicare when I turn 65? So the answer is it depends. If you've already enrolled into Social Security, meaning you're going to collect your benefit, as you approach 65, you will automatically be enrolled into Medicare Part A, which is hospitalization, and Medicare Part B, which is doctors and outpatient. So there will be no action to be taken on your part. If you're some of the majority that probably did not and you are not going to enroll into Social Security yet, you're going to wait till your full retirement age or beyond, you will have to manually enroll into Medicare Part A and or Part B, depending, by communicating to the Social Security Administration or SSA.gov. You're going to put in an application for Medicare Part A, hospitalization, which is your entitlement, or Medicare Part B and or Medicare Part B, which is doctors and outpatient, depending on if you work for a larger organization and you're going to decide to keep your coverage through your employer, or if you're going to move away from your employer's program and onto Medicare individually. This is called the Initial Election Period, or IEP, and the government's full of acronyms. So the initial election period is 3 months before your birthday month, and 3 months after for you to make a selection. And that's the timeline in which you want to make a selection. And by the way, you won't be surprised by all the junk mail that you get, confusing you on doing something and forcing you into a plan you may not understand. Take your time, watch a video like this, and gather your options. The next question is, what if I'm still working at 65? So the world is kind of your oyster here if you're working for a larger organization. And I said this before, what is a larger organization? It's if you are a part of an organization with more than 20 employees. So what that does is that puts Medicare in second position or secondary and your group health plan primary. So when you turn 65, you don't necessarily have to go on to Medicare. If you're in a smaller organization, you will have to enroll in Medicare Part B and pay the premium. But if you're part of a larger organization, more than 20 employees, you do not have to pay for Medicare Part B per se, depending upon the options and what you decide. You can stay on your group plan or you can come off and go on to Medicare. If you stay on your group plan, there is no reason for you to start paying premium for Medicare Part B, doctors and outpatients. Some people are like, what do you mean premium for Medicare? Medicare is not free. Part A, hospitalization, may be free in your entitlement if you've worked the necessary quarters or years, which is 10 years or 40 working quarters, and you've paid into the system. You do not have to pay a premium for Medicare Part A. But Medicare Part B, doctors and outpatient, no matter how many quarters and years you've worked, there is still a premium tied to it that changes every single year. So let's say now that you're going to retire from the company and you decided to stay on the group benefits. The day that you retire creates what's called an SEP, or special election period. It's an 8-month window for you to enroll in Medicare Part B. And during that time, you're going to have to make a decision. When you enroll in Medicare Part B, do you go down the Medicare Advantage route and look at a Medicare managed care plan, or do you go the Medicare supplement route? And inside that 8-month period, the Medicare supplement plan cannot underwrite you for any type of illness or anything that you have going on. It's a guaranteed issue situation where you will get the benefits. Okay, and that's an 8-month window. If you decide for whatever reason, and I don't know why you would do this, maybe you took up a friend's advice, and probably wrongly so, but you decided to elect COBRA after you retire and you're over 65, the 8-month SEP window clock starts, even though you made the election. And what I'll tell you topically about this is once that window closes and you continue on COBRA, because how long is COBRA generally? About 18 months. When your COBRA is about to expire and you're over 65 and you elected COBRA, you're going to realize that you probably will owe a late enrollment penalty back to Medicare for not enrolling in Medicare Part B during that window. And that enrollment penalty you will have to pay for the rest of your life. Sounds great, right? Well, that's why this information is so important. There really isn't any reason for you to take COBRA when you retire if Medicare is sitting right in front of you. And part of that is COBRA is not considered credible coverage where your health plan, when you were actively at work, was. Wait a minute, but it's the same health plan. It works the same. I'm continuing it for 18 months and it's not? I didn't know that. Right, it's not. So we're working hard at trying to get a legislative fix to fix this and make COBRA credible coverage, but it seems that our legislators are doing other things and are preoccupied, and they've kicked this down the curb for years and years. It gets introduced and then the time runs out. So if this is something important to you, you should please contact your local legislator and say, hey, we need a COBRA fix. This is a problem. I don't want to make this mistake. So that's when you're working at 65, past 65. That's the situation on which you're going to have to do a little bit of different learning based upon when you retire. You can enroll in Medicare at any month after age 65 when you're coming off of credible coverage from your employer during your retirement. As long as there's not a 63-day break, there is no underwriting, and you'll be good to go on enrolling in Medicare Part B and getting the solution that you need. So one other question that we get is, can my spouse get Medicare even if they've never worked? So the answer is, as long as one or the other spouse has worked the minimum time, 10 years or 40 working quarters, that spouse will also yield that benefit as well and get Medicare Part A at no cost. Just like the person that worked, though, to get the benefit, they will have to pay Medicare Part B premium, as will as the spouse will, together. So you'll have two Medicare Part B premiums because each individual in the family that's on Medicare is created separately. They'll have two Medicare ID cards, so they'll be able to have to pay Medicare Part B premiums as well. So that wraps up some of the frequently asked questions that we have. If you have any questions, please reach out to us, subscribe. We're happy to help you. We want to cure Medicare illiteracy. It's a big problem. We're looking forward to help one person at a time. Toby Stark, Stark Associates Insurance Agency, happy to help. Take care now. Thanks.